More and more UK health and care workers are absent because of exhaustion. According to a parliamentary report, the whole system is now threatened, not just because of the pandemic. The overload of the British health system was imminent in the corona crisis. However, it was not only the capacities of beds or ventilators that were stretched to the limit. The pandemic has also relentlessly exposed the already tense personnel situation in the British healthcare system, according to a report by the responsible parliamentary committee. The exhaustion among workers in the UK health and care services has thus reached alarming levels. Burnout among staff across the health service, NHS, and the care system poses an extremely dangerous risk to the future functioning of both services, said committee chairman and former Health Minister Jeremy Hunt, according to a statement. He spoke of unacceptable pressure with chronic excessive workload identified as the main cause of burnout in the workforce. In contrast to Germany, the British health system is not financed through contributions from the insured, but directly from the Treasury through billions of euros set annually by the government. The NHS health service has suffered from a lack of staff and resources for years. The pandemic has now exacerbated this problem, the report said. Although the crisis had put great pressure on the employees, job cuts and cost-cutting measures had been identified as the biggest causes of burnout in the country even before the corona situation. The report does not reveal whether Brexit and the associated shortage of foreign workers in Great Britain are also responsible for the situation. It is therefore clear that only long-term personnel planning over 5 to 10 years can solve the problem. So far, the planning has not yet been determined by the demand and the required capacity, but by the scope of the planned resources. In the best-case scenario, this is opaque, they say. In the worst case, it is responsible for the unacceptable pressure on the employees. Boris Johnson's nurse recently pointed out that the work situation in the NHS is bad. Jenny McGee took care of him after the Prime Minister fell ill with corona in spring 2020. Most recently, McGee quit her job due to a lack of government recognition. "We are not getting the respect and wages we deserve," McGee told Channel 4 in May. Many nurses have the impression that the government has acted very ineffectively and indecisively in the pandemic.